Mode.
Hello and welcome. This training will focus on health insurance affordability programs in New York State. The training is broken up in five parts discussing each insurance program. The five insurance programs are MAGI Medicaid, non-MAGI Medicaid, Child Health Plus, the Extension Plan, and the Qualified Health Plan. This topic will be on non-MAGI Medicaid. So here is the training outline. Child advocates and volunteers will be provided with an overview of how non-MAGI Medicaid works. By the end of the training, you will know what is non-MAGI Medicaid, what is the eligibility criteria for it, and how someone can enroll into the program. You will also learn and get an understanding of how non-MAGI Medicaid consumers get access to care that they need, as well as their appeal and fair hearing rights when things go wrong. Furthermore, this training will discuss other types of non-MAGI Medicaid programs. And lastly, we will provide you with a list of resources for more information on this topic. So what is non-MAGI Medicaid? Non-MAGI Medicaid is comprehensive health insurance coverage. It provides an extensive list of covered benefits, which we will discuss in the next slide. It helps pay for medical costs for people with very limited income and resources, and it is paid by the state and or federal government. Most people who are eligible for this program are either age, meaning they are over the age 65, blind, or disabled. Another name used to describe this population is SSI related. The non-MAGI Medicaid eligibility rules is different from MAGI Medicaid. To find the eligibility rules, you will refer to the New York State Medicaid Reference Guide. It is the Medicaid Bible. The income threshold for most consumers are less than 100% of the federal poverty level. And the resources and their assets are also counted. So what does non-MAGI Medicaid cover? It covers all medically necessary care. These include, but not limited to, inpatient and outpatient care, mental health and substance abuse services, labs, prescriptions, and dental services. Unlike the medical services, MAGI Medicaid only provide limited dental services. For a complete list of dental services, you can view eMedMe's website. This website is mainly for providers, and they will provide, information about the Medicaid program, but the public also has access to it as well. One benefit you would not find covered or is a very limited benefit under other insurances is home care and nursing home services. Home care includes services such as personal care and skilled nursing. You can also find a complete list of covered services in the Medicaid Managed Care Contract in Appendix K, and we will discuss more about Medicaid Managed Care later in the training. Non-MAGI Medicaid consumers are protected from balance billing. Balance billing is when a provider bills the difference between the provider's charge and the amount paid by the insurance company. For example, if the provider's charge is $100 and the insurance pays $70, the provider may bill for the remaining $30. Once a provider enrolls and becomes a Medicaid provider, they are prohibited from balance billing any Medicaid consumer for covered services other than applicable copays. As a child advocate and volunteer, you will come across Medicaid consumers who are being billed by providers. Therefore, you as a child advocate or volunteer will need to know the rules when it is permissible for a provider to bill a Medicaid consumer. So if the provider is an accepting Medicaid provider, they are required to confirm the consumer's eligibility prior to providing any services or treatment. If they fail to confirm their eligibility and they provide the services and then later find out that is not being covered by Medicaid, then they have to eat the bill. They cannot bill the consumer. The only circumstance in which a provider can bill a Medicaid consumer is in a non-emergency situation where one, the provider has advised the patient or consumer that the services will not be covered by Medicaid, and nor the vendor does not accept Medicaid. And two, the provider has obtained the patient's consent to be responsible for the services prior to providing them. You can find more information on the New York State Department of Health website about balanced billing, and you can also view child medical billing training that will go over how to handle medical billing type cases. So now let's move on to the non-MAGI Medicaid eligibility. There are 6 eligibility criteria that a consumer must meet to qualify for non-MAGI Medicaid. The first one is category. So the category is the population in which the consumer fall under. Then we need the household size, which is the number of people who are considered as part of the household and must be included on the application. 3, the income. So what is the income threshold? The resources. There is a resource threshold as well. Citizenship and immigration status, and residency. So the first criteria is category. So in addition to consumers who are aged, over 65, blind or disabled, here is another list of consumers who fall under the same category. So individuals who are receiving supplemental security income, which is SSI, or cash assistance, also known as public assistance, they will fall under this category. Individuals who or consumers who need long-term care services, medically needy spin down, and we will talk about that. The Medicaid buy-in program for working people with disability, we'll talk about that as well in this training. Cancer treatment programs, we will talk about that as well. And also former foster care youth. So if a consumer is under the age of 26, they will automatically qualify for Medicaid as long as they were a foster care child and also receive a Medicaid before they turn 18 or at 18. So if you know any of those consumers or have, their case should be at the non-MAGI Medicaid services. Consumers who are receiving Medicare, the only exception is they are a parent caretaker. They don't have to actually be a non-MAGI Medicaid. Consumers that are in adult homes, residential treatment centers, and individuals who have COBRA insurance. Individual consumers who have COBRA insurance and they want assistance from Medicaid to pay for their COBRA premiums, they can do that at the non-MAGI level. Now, there are some consumers who will receive what is called MAGI-like budgeting through LDSS. So these individuals may be receiving Medicaid at the non-MAGI district, but when the worker is budgeting or trying to see if they're eligible, they will actually use the MAGI budget budgeting rules. And so these individuals are consumers who are certified disabled, but they're under 65 and they have not received Medicare yet. And parents or caretakers of a child under the age of 21. And again, even if they're over 65 and or have Medicare. Now let's move to household size. So household size is not necessarily an eligibility criteria, but it is important because it tells you whose income and resources count when determining a consumer's Medicaid eligibility. The household size can only be either 1 or 2, and that only depends on whether the consumer's spouse is disabled and their monthly income. When using non-MAGI Medicaid budgeting, you cannot count in the consumer's children in the household. However, there is something called allocating and deeming that can be applied. And so allocating with allocation is income that are set aside for the needs of their non-SSI related children under the age of 18, and also for the needs of parents, regardless of category, of the SSI related children or child. Deeming is income of a legally responsible relative in the household and is considered available to the SSI related consumer. So first they do the allocation, and then whatever is left over is considered deemed available to that legal responsible relative. Non-MAGI adults with children can choose MAGI budgeting if this methodology is more advantageous. So if it is, then what they would technically do is first screen the individual for non-MAGI, and if they're not eligible for non-MAGI, then they will screen and do the MAGI-like budgeting. So now let's talk about when will a client be considered or a consumer be considered a household size of one or a household size of two. So if the individual lives with a non-MAGI spouse and there is no children in the household under 18, the household size is going to always be two. And since it's always two, all of the income is included. Now, if the consumer who's applying lives with a MAGI spouse and has no children under the 18, they are a house size of one if that spouse's income is less than $391 a month. If so, it does not count against the consumer who is applying. But if it's more than $391 per month, then it's a household size of two, and all of the income goes towards that household. Now, if that applicant or consumer who lives with a MAGI spouse, but they have children in the household under the age of 18, it is a household size of one. Again, if the spouse income is less than $391, and it doesn't count. But it's a household size of two if it's more than $391, but is applied after allocation is applied to the children. So the allocation amount changes every year. So to determine the amount for the year, you simply it simply is the difference between the Medicaid income level for a two-person household and the Medicaid income level for the individual, for an individual. So the next criteria is income. And it's important, it's totally different from the MAGI Medicaid. So income is any money earned or unearned received from any source, and it may be reoccurring or a one-time payment. So earned income is money received as a result of a work activity, such as wages from employment, tips, or commission. Unearned income is money paid because of legal obligations like child support payments, Social Security payments, unemployment benefits, interest, or dividends from an account, or support from a relative. Now, support from relative may or may not be counted depending on how it is received. So there's something called in-kind support, which is contribution of goods or services from individuals who are not legally responsible for supporting the consumer, that is not counted as income in the eligibility determination. So let's give you an example. So we have Joe. He pays his mom's landlord $100 per month for rent. This is considered in kind and does not count as income from Joe's mom. Now, if Joe gives his mom $100 in cash for rent every month, then this would be counted as income. Because the money is because the consumer is receiving the money in their hands, it would be considered as income. But if, again, the relative paid the landlord directly or the mortgage company directly or go to the grocery store and buy the groceries, the food, and give to the consumer, that is considered in kind support and that would not count as income. So, how is income calculated? First, you need to know it is based on gross income. So, any income before taxes. It is also determined on a monthly basis. So, all income, including lump sums. So, if they receive back payments on something, whatever that lump sum is, it will be counted in the month that it is received. Now, you may have some consumers who don't get paid once a month. They sometimes get paid weekly or bi-weekly. If they get paid weekly, the gross income is multiplied by 4.33. If paid bi-weekly, it is multiplied by 2.16. If you do not use these calculations, you can, mistakenly pre-screen, get the calculation wrong, and that consumer may actually not be eligible if you only apply it, multiply it, for example, with the weekly only by 4 times instead of the 4.33. Now, there are some income disregards for non-MAGI, and disregard is basically income that won't be counted. So some automatic discounts are the first $20 of unearned income. For earned income, the first $65 is disregarded. And then half of the remaining income is also disregarded for those who are earning income. You can also get a disregard if you have other health insurance that you're paying for. So health insurance premiums can be counted as a disregard. And for additional disregards, you should visit the New York Health Access website that will give you additional list of income disregards. Consumers must report any income changes, and Medicaid will make a new eligibility determination. So there is no 12 months continuous coverage. Once you report the income change, Medicaid will make a redetermination to see if that consumer is still eligible. Here are the income limit chart. This is for 2018. These figures changes every year in March, around March, April. So you want to make sure you have an updated chart, and you can find that on the New York State Department of Health website. Like I said, resources is a test that the consumer must meet to see if they are eligible for Medicaid. The resource test only applies to consumers who are over the age of 18 and consumers who need long-term care. What are resources? Resources are cash or assets that can be converted into cash, such as bank accounts, like checking and savings, CDs, life insurance, stocks and bonds. Now, property, the primary residency is not counted, but if that individual have a second property, then that would be considered a resource. And then you have retirement accounts like IRAs or annuity. If it's in payout status, then it counts as income. So if income is not spent in the month it is received, it becomes a resource in the next month. Now, these are some resources that do not count towards eligibility. And these are such as like personal property, jewelry, clothes, or paintings. Again, the primary home, so the home where the applicant lives in the car. More than one car may be counted. And here is a 2018 resource limit chart. So as you can see, for one person, the resource level is $15,150. Now, there are 3 levels of Medicaid coverage. If you have a consumer who needs a particular benefit, then you will need to make sure that they have submitted the appropriate document in order for them to receive that benefit. First, you have level one. Level one is considered community Medicaid. So it provides all the standard Medicaid benefits, and it will also include 120 hours, up to 120 hours of long-term care. And again, long-term care services are like home health care, adult care, or assisted living. If your consumer only needs those benefits, then when they are applying, they do not have to show any proof. All they need to do is self-attest their resources. Just simply write down how much resources that they have, the number. However, if they need level two type of Medicaid, and this is Medicaid with long-term care, it's going to provide the same benefits as those found in community Medicaid, but it's going to include long-term care services for more than 120 hours. And if they need more than 120 hours of long-term care, then they must document resources, and it has to be the current month. So if they're applying in November, they don't have November bank statement yet, they should at least have October's bank statement. And then you have level three, which is institutional Medicaid. And it provides everything covered in the first two levels of Medicaid, but it's also going to include nursing home care. And if you need nursing home care, the consumer will need to document 5 years of resources. That is known as the 5-year look back. What happened is during that 5-year look back, Medicaid is seeing if that consumer was at any time over the Medicaid resource limit. If they do find that the consumer, for example, was over the resource limit for maybe 1 or 2 months, let's say 2 months, Medicaid will not pay for that nursing home for the first 2 months, but they will pay it moving forward. So it's a bit tricky. And so if you have questions about the 5-year look back or have any concerns, please reach out to community health advocates, to your appropriate supervisor. The fifth criteria is citizenship and immigration status. So all consumers must have some qualifying citizenship or immigration status, which that includes U.S., United States, or naturalized citizens. They must be a qualified alien, such as a legal permanent resident, green card holder, refugees, asylees, status spouses, and some can be permanently residing under the color of law, which is protocol. And that includes documents. So protocol, just note that protocol is not an immigration term used by the United States Citizen and Immigration Services, USCIS. It is a term used for public health benefits, eligibility criteria such as Medicaid. Now, consumers that are not eligible or immigrants that are not eligible are consumers who entered across border without inspection and consumers who overstay their visa. They're not eligible. I do want to make note that non-immigrant, temporary immigrants are eligible for non-MAGI if they can meet the residency requirement. So this is the last criteria. So every consumer must be a New York State resident. And to qualify to be a New York State resident, not only must they live in the state at the time of application, but they have to have the intention to remain in New York State indefinitely. There is no minimum time limit to have lived in New York State to establish state residency. Now, for some, we'll need to prove residency, right? So most consumers will just need their New York State home address, But like I mentioned, the non-immigrant visa holders must establish residency by answering affirmatively to one of the following residency questions, such as have they or their child applied to adjust their status to become a permanent resident? Do they currently work? Or do they have children that go to school? Or do they own their home or rent a house or an apartment? So let's do an eligibility case example. So we have Daniel who calls the helpline because he cannot afford to pay his Medicare 20% co-insurance and wants to know if there are other options for him. So these are the questions you're going to ask. Well, what is your age? 65 and older. Well, where does he live? He lives in Chenango County. Well, what is his immigration status? He is a U.S. citizen. What is his household size? He's single and he has no children. Okay, what is his income? $820 from Social Security. And what about resources? He has a bank account with 9,000 in savings. Well, can Daniel qualify for non-MAGI Medicaid to help cover the 20% insurance? Yes. He meets the eligibility requirements because he's 65 and older. He lives in New York. He's a U.S. citizen. His income is below 100% of the FPL, and his resources is below 15,150. Now, you pre-screen the client, they meet the eligibility, so how do they now enroll into non-MAGI Medicaid? So, consumers would apply for non-MAGI Medicaid through the local Department of Social Services or HRA in New York City. And here's the link that provide a list of local Medicaid offices in local districts, Department of Social Services. Now, there is in-person assistance through what is called Facilitated Enrollment for the Age, Blind, and Disabled program, and that's the FEABD. There are community-based organizations that help the aged, blind, and disabled enroll in and understand public health insurance throughout New York State, and there is a telephone number that they can call. So facilitated enrollees, they can assist consumers who are homebound if the consumer has difficulty traveling or communicating by phone. They can provide education sessions for consumers, caregivers, or other service. All of their services are free and confidential, and they are not connected with any health insurance plan. So by federal law, now they applied, right? They applied. Um, so they applied either through the Medicaid office or through an FEABD, and they submitted their application. By federal law, the local districts are required to make an eligibility determination within a specific number of days from the date of the consumer's signature. So 30 days for pregnant women and children under the age of 19, 45 days for adults without disabilities, and 90 days if an adult child needs a disability determination. Retroactive coverage is available. Benefits can be retroactive for 3 months prior to the month of application, but only if the consumer was actually eligible during that period and the consumer must request such coverage. Medicaid will pay the consumer's outstanding unpaid medical bills to Medicaid providers incurred during the 3 month period, as well as reimburse the consumer for Medicaid covered procedures paid at the Medicaid rate. So, in order to keep their non-Magi Medicaid coverage, they will have to renew every year. So, they have an annual recertification, and it's required by federal law. So, what they'll do is that they will get a mail-in renewal. So, they'll get a mail-in notice 2 months prior to the end of their 12-month period, and it's going to be sent to their last known address. If 30 days prior to the end date to submit, and they'll receive a remainder postcard if they haven't submitted. Packets must be received by the due date and not mailed by the date. So it does not matter if they go to the post office to get a stamp to say, hey, it's been, I mailed it out in time. Look at the date on the envelope. It's not according to that. It's according to when the Medicaid actually received their packet. If the consumer fails to submit that renewal notice, their case will be closed, and so they'll receive that notice packet if there's, like I said, not received by the due date. If the client does not mail the packet on time, and it's within 30 days of when their case is closing, they can actually go to the Medicaid office with that mail-in renewal packet and submit it as if it is a new application. So they don't have to do the whole, new application. But if it's after 30 days, that's when they have to complete a new application. They will not be able to use that renewal. Consumers who have other insurance can still be eligible for non-MAGI Medicaid. The only time when non-MAGI Medicaid they won't be able to, enroll into non-MAGI Medicaid if they have Child Health Plus or they have some other type of New York State uninsured care program. But other than that, they can have other insurance. And Medicaid will act as secondary insurance and is the payer of last resort. So, in order for Medicaid to cover services, the consumer must use doctors who accept both primary and secondary insurance to avoid being billed. So that's all about enrollment. Now let's move to other Medicaid programs, non-MAGI Medicaid programs that is available. So if a consumer is not eligible for non-MAGI Medicaid because they do not meet the income eligibility requirements, there are other programs available to them. And they are the Access Income Program, which is known as a spin down, the Medicaid buy-in for working people with disabilities, and MBI WPD, the Medicaid Cancer Treatment Program, and then family planning benefits. So consumers whose income is above the non-MAGI Medicaid limit may be eligible for the spin down program. Spin down is any income above the income limit. For example, if the consumer's income is $1,000, the Medicaid limit is $842. So you subtract 1,000 by 842, the remaining 158 is their spin down amount. So Medicaid says, we will give you Medicaid if you either incur medical bills in the amount that is equal to your spin down, or pay Medicaid directly, your spin down, Medicaid spin down directly to Medicaid. Parents, minor children, less than 18, people with disabilities, right? All of these individuals are eligible for the spin down. Unfortunately, single adults and childless couples cannot spin down to get Medicaid. Spin down must be met each month in order to activate and get Medicaid coverage. However, a consumer do not have to meet their spin down every month if they do not need coverage at any given month. The consumer can decide when to activate Medicaid or not. But If the consumer do not activate their Medicaid at least once within 6 months, then it is possible that their Medicaid case will be closed. You may be wondering, why would a consumer enroll in a spin down program, especially someone with a huge spin down amount? Some reasons would be they may have high medical needs that's not covered by their other insurance, such as home care or nursing home. Or they may have had an emergency and in thus, in return, like have a huge medical bill from the hospital. So that's why when you are screening consumers for non-MAGI Medicaid, you should also screen them for the spin down program to see if it will be appropriate for them or not. Now, there are some challenges with spin down. It's not a smooth sailing. Um, there are logistic challenges because the client or the consumer must submit their bills to LDSS or or pay them directly before Medicaid approves or activates the Medicaid coverage. And so therefore they are waiting at the hands of LDSS or HRA to process their spin down fast so that their Medicaid can become active, and then therefore when they go and see the doctor run their card and the doctor will see that their Medicaid is active. Sometimes the doctor runs the card and it says that it's inactive. Unfortunately, not all Medicaid providers know about the spin down program, not know that they eventually will probably get paid. Um, and so sometimes it's educating the provider about the spin down program. But again, these are some of the challenges that a consumer can have with spin down. Like I said, the activation challenges can prevent them from accessing services. Now, there are two ways a consumer can meet their spin down. Submit paid or unpaid bills that equal the amount of their excess income to Medicaid offers each month, something like a deductible, or pay the excess income amount directly to Medicaid each month. It's like the health insurance premium, right? The local Department of Social Services, HRA in New York City, will determine the eligibility for this spin down program. If a consumer decides to submit bills to meet their spin down, they need to understand that not all bills are treated the same. There is a difference on how bills are applied when the bill is paid versus unpaid. Paid bills can be used to meet the spin down for the current month and future months. Medicaid will only accept paid bills provided in the 3 calendar months before the month of application, which is the retroactive period, and or during the application month. For example, the consumer applies for Medicaid in June and has a spin down of $100. The consumer submitted paid bills for services rendered in March, April, and May, and the total amount of $500. With these bills, the consumer met their spin down 5 times, right? Therefore, they will receive Medicaid coverage for 5 months: June, July, August, September, and October. That is not the case for unpaid bills. Unpaid bills can only be used to meet the spin down for the current month. However, it can be owed unpaid bills, but those unpaid bills must be valuable, meaning the provider is still trying to collect. Rule of thumb is 6 years. So providers can only try to collect for 6 years. If they are using very old unpaid bills to meet their spin down, it's not like Medicaid is going to pay those bills. No, that consumer is still responsible for those unpaid bills. But Medicaid will say, okay, Based on these old bills, you have met your spend down, and just use the same example of the $100, and it was $500 for 5 months. And so they will give the client only the activated only for that current month. It's not going to give them future months. So let's use another example. The consumer spend down is $100, and they have an unpaid bill in the amount of $200. The consumer is going to be responsible for a $100 portion of that bill, because Medicaid will never pay what the consumer is responsible for. Medicaid will pay the amount above the $100 and then also activate their Medicaid for the rest of the month. If a consumer has any paid bills, they may can receive reimbursement for it, but again, it's at the Medicaid rate. We're not going to go into great detail of the spin down, but you can find more information about the spin down on the New York Health Access website. One thing I do want to mention before moving on to the other non-MAGI Medicaid program is to discuss the coverage that spin down will provide. So if the consumer is meeting their spin down once a month, they're only going to be receiving or eligible for outpatient type care services and coverage. In order to receive inpatient coverage and outpatient coverage, they will have to incur medical bills that is equivalent to 6 months of their spend down. So for example, Joe has an inpatient surgery. His monthly spend down is $100. Joe submit bills in the amount of greater than $600 in order for his inpatient coverage to kick in and for that bill to be covered. So Medicaid will not cover the first $600, but anything above that amount, Medicaid will pay. Another program under the non-MAGI Medicaid is the Medicaid buy-in for working people with disability. It is full Medicaid benefits for disabled working adults who would otherwise be over income. And the eligibility for the program is that the consumer must be between the ages of 16 and 64. They must have a disability that is defined by Social Security Administration. And the kicker is that they must be engaged in paid work. But there is no minimum requirement. The consumer can work just 1 hour per month and meet the paid work requirement. The consumer income must be below 250% of the federal poverty level, and their resources will be, what threshold is $20,000. So here is the income limit. So as you can see, a household size of 1, their income can be $2,530. Someone can be eligible for this program making close to $40,000 a year. Why? Because remember earlier I mentioned that there are some income disregards. So for earned income, the first $65 is disregarded, and then half of their earned income is also disregarded. So for more budgeting rules or how to budget someone for this program, please reach out to the appropriate child supervisor. So let's do a Medicaid buy-in for working people with disability case example. So we have Lynn, who calls the helpline because she can't afford her Medicare copayment and wants to know if she is available for any cost sharing program. So questions to ask Lynn: what is her age? 59. What is her household size? 1, so she has no children. Her income is $1,500. Okay, but you need to know from where. So She get Social Security disability income. Any other? Yes, $200 from babysitting. Resources, about $15,000. What is her residency? She's from Brooklyn. And immigration status is U.S. citizen. What will you advise? So Lynn is considered non-Magi Medicaid eligible because she is receiving Medicare and she is not a parent caretaker. She is over the Medicaid limit for a household size of one, which is 842, because her income is $1,700. She is, however, otherwise Medicaid eligible, right? Because she meets the other Medicaid criteria. So these are Lynn's options. Now, she can choose to select a Medicare supplement product, and these are products for consumers who have Medicare, so they can join like a Medicare Advantage plan or Medicare. Now, this could be a good option if she does not need Medicaid covered type services. Okay, and we talk more about the Medicare supplement um, information in the Medicare training. So, if she doesn't want to do the Medicare supplement, she can do the Medicaid spin down. Now, this is good. This could be an option if she needs home care services, but the best option for her probably would be the Medicaid buy-in. She is eligible because of informal work as a babysitter, and by doing this program, she will be found eligible for Medicaid without having to pay a spin down. Now let's talk about the Medicaid cancer treatment program. Now there's another non-mandatory Medicaid program that helps provide treatment for consumers with cancer. And this program is called the Medicaid Cancer Treatment Program. Consumers must meet one of the following cancer diagnoses: um, breast cancer, cervical cancer, colorectal, or prostate cancer. And the other eligibility requirements is that they cannot have any other health insurance at the time of application. And for individuals with breast or cervical cancer, there is no income or resource limit. However, colorectal and prostate cancer consumers under the age of 65 and at or below, their income must be 250% of the federal poverty level. Another thing is that they must complete their application with the New York State Department of Health Cancer Services program, which you can find the link here to get a listing of where to apply. Now, the last non-Magi Medicaid program that's available is the family planning benefit. The family planning services is services such as birth control, family planning visits, pregnancy testing and counseling, screening, and treatment of sexually transmitted infections. Eligibility requirements for this program is that, of course, you have to be male or female of childbearing age, must be a New York State resident, must meet the U.S. citizen and immigration status, but their income can be a little higher, up to 223% of the FPL. But these individual consumers cannot already be enrolled into Medicaid. And consumers can apply at any family planning services provider, and they can receive what is called presumptive eligibility and get assistance right away. And there's a link to a list of family planning program sites. Now, I do want to note is that pregnant women, including undocumented women, receiving Medicaid, this is known as Family Planning Extension Program, are entitled to family planning services for up to 24 months after the 60 days postpartum period. And you can also find out that information on the New York State Department of Health. Sorry, there is one more non-Magi Medicaid program, and that is emergency coverage only. So is Medicaid for the treatment of an emergency medical condition? It's only for consumers who are undocumented, but they meet the other Medicaid eligibility criteria, such as their income, residency, and non-MAGI categories. They must have a medical condition that meets the emergency medical condition standard. So they must be treated at an emergency room, but also have this type of medical condition in order for Medicaid to cover that particular emergency. So it's a condition that places the person's health in serious jeopardy or seriously impairment to a bodily function or serious dysfunction of any bodily organ or part. Unfortunately, there are some medical treatments that are considered an emergency, but is not going to be covered by Medicaid. Organ transplant will not be covered. Alternate level of care in the hospital is not going to be covered. Nursing home care, or rehabilitation services. So to apply for emergency Medicaid, the consumer will apply for emergency Medicaid through HRA or the local Department of Social Services. They will need to renew their financial eligibility annually, so every year. They will receive a Medicaid card, and so you need to explain to the consumer that the Medicaid card can only be used when they are having an emergency medical condition. And in the emergency, the attending physician will need to certify that it was an emergency medical condition and fill out the form and submit it to Medicaid so that Medicaid will pay for it. All right. I know that was a lot, so take a rest, a little breather, before we move on to the next session. All right. So, non-MAGI Medicaid. How does someone with non-MAGI Medicaid access care? So, consumers who are in any of the non-MAGI Medicaid programs mentioned will access services in either two ways: through fee-for-service Medicaid or through Medicaid managed care. Fee-for-service Medicaid is referred to as straight Medicaid, and consumers must use providers that take straight Medicaid. The providers then bill Medicaid directly for each services provided, and then Medicaid has a pre-established rate that they will pay for each covered services. Please note, most non-MAGI Medicaid consumers will be in fee-for-service Medicaid because it's most likely that they either have Medicare or they need some type of long-term care services, and so they will probably be in fee-for-service Medicaid. However, if they do not meet any other criteria to make them exempt or excluded, then they will be required to enroll into a Medicaid managed care plan. And all of the Medicaid managed care plans are HMO type plans, and you should view the health insurance overview training for more information on HMO plans. The consumers must select the plan at time of application. If not, they will be auto-assigned. However, they can change plans during the first 3 months of enrollment and during renewal. As I mentioned before, there are some consumers who are exempt or excluded from enrolling into a plan. So what is an exemption and who is excluded? So exemption are consumers that has the option to enroll or join a Medicaid plan or stay in fee-for-services Medicaid, or they are excluded, meaning they cannot enroll in a Medicaid managed care plan. And some examples would include consumers with other comprehensive insurance, such as Medicare or employer-sponsored insurance. They probably receive in hospice services or waiver-type services, or they may have limited Medicaid coverage, like individuals with emergency Medicaid or have the family planning benefits. They will be definitely excluded from enrolling into a Medicaid managed care plan. Now, some covered services must be pre-approved before services can be covered. This is known as prior authorization. For example, ambulatory surgery is a covered benefit that requires prior authorization from the plan. Consumers with fee-for-service Medicaid will need to contact the Medicaid helpline to obtain a list of covered services that require prior authorization. If they need prior authorization, their provider will be the ones to request it through a system known as e-papers. If the requested health service is denied, then that consumer can appeal that decision by requesting a fair hearing. Consumers with Medicaid managed care, they would just use their health plan policy for covered services that will be required for prior authorization. The managed care providers will be the ones to contact the plan and request the prior authorization. And again, if it is denied, we urge the consumers to appeal the plan's decision. Also keep in mind that receiving prior approval does not guarantee services will be covered. Now we are going to talk exclusively about how to access care under fee-for-service Medicaid. Consumers can go to any doctor or hospital that accepts fee-for-service Medicaid. Although they have the freedom to go anywhere, it is sometimes difficult to find providers. There are small copays for certain services, and you can find a list on the New York Health Access website, and also a list of covered services found in the Medicaid pharmacy program. Also want to note about the pharmacy benefits. If you have a Medicare consumer, then Medicaid will not cover most of their drugs because they have to enroll into what is called a Medicare Part B plan that covers their prescriptions. Medicaid will only cover drugs as a wraparound service. So if the drug is listed under the wraparound service, then Medicaid will cover it. If not, they will have to go through the Medicare Part B appeal process to try to get that prescription covered. So here is a list of non-MAGI Medicaid copays. Depending on a service, such as a clinic visit, the amount copay will be $3. Here's information about the details about the copay. So what is considered a clinic visit, like outpatient clinic in a hospital or freestanding clinic such as a community health center. However, if it's a particular clinic such as mental health clinic or family planning or these others listed here, then there should be no copayment for those services. Now let's talk about Medicaid managed care. As I mentioned before, all Medicaid managed care plans are health maintenance organizations, HMO. There are no out-of-network benefits except in an emergency or for network inadequacy. There is a primary care provider requirement, so they have to select a PCP, and they will need a referral from their PCP in order to see a specialist, with a few exceptions, like a mental health provider or OBGYN would not need a referral. There is no monthly premiums, and again, the copays is very limited in the Medicaid managed care plan. So the consumer must use doctors, hospitals, pharmacies, labs that are part of the plan's network. Again, unless it's an emergency or the plan pre-approves out-of-network services because there is no in-network provider. Consumers must choose a primary care provider, PCP, within 30 days from the effective enrollment date. If not, one will be selected for them by the plan. Consumers can change their primary care provider once a month. Consumers must get a referral from their PCP to see an in-network specialist. However, they can request a standing referral if they need to see a specialist more than once or for a specific period of time. And these are only for consumers with a chronic, um, disabling, or degenerative condition. They only going to get that right for a standard referral, and they also have a right to access to specialty care centers. Consumers also have the right to file a grievance if they are not happy with the services they receive, and or an appeal if they are denied a service. And we will talk about more about this in the next portion. Some Medicaid managed care plans may offer additional services, and so you want to look at the member's handbook to see what additional services they're providing. So if you have a consumer who has asthma, they may want to look at the Medicaid managed care plans that has an asthma case management program. Or again, with diabetes, you may want to look at the diabetes case management services. Consumers enrolled in the Medicaid managed care plan will only have copays for their prescriptions. So if you have a consumer saying that they had to pay a copay when they went to see their doctor, that is a red flag and should be reported to the plan. The copayment amount varies based on the type of drug. For example, if it's a preferred, non-preferred brand name drug, the copayment is $3. If it's a generic, $1. Medical supplies, $1.50 for non-prescription, which is over-the-counter drugs. If they need an over-the-counter drug, they will still need to get a prescription from their doctor in order for it to be filled. Now, there is a $200 annual cap on copays per consumer. Once a consumer pays $200 out of pocket, they should no longer be responsible for any additional copays until after they renew their coverage. Consumers should receive a letter if they meet that cap. Pharmacies cannot deny prescriptions due to the consumer's inability to pay. However, pharmacists have the right to request a copayment each time a consumer needs services or goods, ask the consumer for outstanding copayments the next time he or she comes in, and use other legal means to collect copayments. Some consumers are exempt from prescription copayments. And here is a list, and it's not the complete list, but individuals who are under 21 should not have a copayment for prescriptions. Pregnant women during the pregnancy and 60 days postpartum shouldn't pay any copayments, and there is a list that you can find on the New York State Department of Health website. One thing I want to talk about is consumers who are receiving care and they are mandated to enroll into a managed care plan, but their doctor is not in their plan's network. They can get something that is called transitional care. And so if the consumer has a life-threatening or degenerative or disabling disease or condition and are receiving an ongoing course of treatment, they are eligible for up to 60 days of transitional care. Pregnant women who are entering their second trimester can receive transitional care through their postpartum period. So through the end of their pregnancy plus the 60 days postpartum. And consumers who are engaged in the course of treatment and the provider leaves the plan network for reasons other than fraud or disciplinary action will be eligible for up to 90 days of transitional care. And again, if it's a pregnant consumer in their second trimester, they can actually get it through their postpartum. So here are some steps that as a child advocate or volunteer will take when a consumer needs transitional care. You want to confirm that the provider actually does not accept the plan. Then you want to ask the provider if they are willing to bill as out of network and explain that they will be paid the plan's in-network rate. If the provider agrees, great, go to the next step. But if they do not agree, then the consumer will need to decide what they will do, either pay out of pocket or they would need to find an in-network doctor. So if the provider is willing to be billed as out of network and accept the plan's in-network rate, Then you should contact the plan and find someone who handles transitional care. Not everyone who picks up the phone on the first try would know what transitional care is. So you want to speak to someone who's familiar with the policy on transitional care. When you do, you want to learn the plan's process for the provider to help the provider with the billing. So it makes it a little bit easier to explain to the provider office what they would need to do. This would also um, help if the provider is like kind of iffy and not too sure if they're willing to accept as out of network. If you can show them how the billing process works and make it easier for them, then it may work, and the provider may say yes, actually. You also want to be persistent. Again, sometimes the provider may not be willing, or the plan may not be familiar with the transitional care. The consumer, as an advocate, you know the consumer's right, and so you want to just be persistent in trying to get the care that they need. If it's just not working, you should file a complaint with the New York State Department of Health Office of Managed Care, and the number is there, especially if the providers are not willing to bill. I think it's important that we want to keep track of how many complaints of providers not willing to fulfill, um, being accepted to the out of network rate, in an in network rate, and to bill as out of network. But remember, if that provider does still take Medicaid, they may not take the plan, but they do take Medicaid, they are still prohibited from balance billing, right? So they can't bill them at all. So let's move into appeals, grievances, and fair hearing. Right. So this is the fair hearing right for individuals consumers who are enrolled and have fee-for-service Medicaid. So consumers with fee-for-service Medicaid can only request a fair hearing when they receive a denial or a reduction of medical services, denied Medicaid eligibility, or their Medicaid is being terminated. What is a fair hearing? It's basically the consumer is given a chance to tell an administrative law judge why they think a decision about their case is wrong. And that consumer will have 60 days from the date of that denial to request a hearing. If they request a fair hearing and they want to continue to receive benefits as is until their fair hearing decision is issued, they can request what is called aid to continue. But they can only get aid to continue if they file their fair hearing and request it within 10 days of the denial notice. Fair hearings can be requested online, which is the best way to do it, but they can also mail in the request. They can make a phone call and also fax. Now, consumers enrolled in Medicaid managed care plans have the right to not only a fair hearing, but they do have a right to file an appeal or a grievance when things go wrong. So an appeal is basically payment denied for services already received, prior authorization denied for services not yet received, and plan is reducing the services consumer is already receiving. Now, there are two types of appeal. There are internal appeals, which are filed within the managed care plan, and then there are external appeals, which are filed through the New York State Department of Financial Services. If the client is not satisfied with the care that they have received, or something about the plan, such as like waiting a long time for an appointment with their PCP, or it takes too long to process an appeal, then that consumer can file what is called a grievance. And a grievance is, again, it's different from an appeal. As I mentioned before, consumers can also request a fair hearing, but after they have exhausted all of their internal plan appeals for service denials. Okay. If The denial is for eligibility determination or terminating their Medicaid. Then they can just automatically request a fair hearing, and they have to request that fair hearing um, within 60 days of that particular notice. But if it's a denial for a services that the plan denied, then they have to exhaust their internal plan appeal. Once they do, the consumer have 120 days from the date of their final adverse determination denial to request a hearing. They also have the right to keep their benefits continued until the fair hearing decision is issued. So this is the A to continue, but they will have to request it twice. We have to request it at the internal appeal level, so within 10 days from the notice date of the initial adverse determination, and then the fair hearing again within 10 days of the notice of the final adverse determination. And they can request it the same through online, mail, phone, or fax. So here is the appeal timeline. So the consumer received a notice. Either it's a denial from the plan. If it is, which is called the initial adverse determination, they have 60 days from the date of that notice. And if they want A to continue, they must request it within 10 days. So they requested the internal appeal, and it was denied. Then they will receive what is called a final adverse determination, and they have 120 days to file or request a fair hearing, and again, request A to continue within 10 days. But they can also request an external appeal, and the external appeal is 4 months from the final adverse determination. And you can either do that simultaneously in 60 days for providers. So providers can also request an external appeal, but they only have 60 days to do so. But if the consumer or you help the consumer file external in a fair hearing, the fair hearing decision will trump the external appeal. So the external appeal, you most likely will get a decision quicker than the fair hearing date. So what you want to do is, if you win your external appeal, you should withdraw your fair hearing because you already won. But if you lost your external appeal, don't withdraw the fair hearing. Still go through the fair hearing, because if the fair hearing come out favorable for the consumer, that fair hearing will trump the external appeal. And lastly, resources. So here is a list of resources. Again, I was not able to provide a lot of information about non-MAGI Medicaid. This is just really an overview. But if you want additional information about any information that we went over, or just additional information, here is a list of resources. So the Medicaid reference guide is, again, the Bible. It tells you all you need to know about the eligibility criteria and how to do the budget methodology. For consumers who are in the Medicaid managed care program, you want to view their model contract to make sure this is what they are supposed to do and they're getting the services that they need. So this provides the rules that the plan must follow. Then you have the administrative directives and the general information systems, and this is basically guidance to advise local social services districts of policy and procedures which must be followed in the administration of programs. Then you have the Medicaid Provider Manual. This is the eMedNI, and again, it's information for providers on how Medicaid works and how to submit claims. And then you have Medicaid Update, and this just provides up-to-date changes in the Medicaid program. And these Medicaid updates are given to providers as well. So that concludes the non-MAGI Medicaid training. If you have any questions, please feel free to speak to your appropriate SHA supervisor. Thank you for attending.